What's up, guys? Welcome to another episode of the Good Locks Dogs podcast. I'm Dr. Eric Perret.
And I'm Dr. Asi Perret.
Today, guys, as promised, we're going to do the part 2 for the finasteride. We're going to discuss custom dosing, side effects, and post-finasteride syndrome.
Guys, you know our content's all about helping people with hair loss. And if you like it, please like our videos and subscribe to our channel.
So let's get on with this.
Welcome to the Good Locks Dogs podcast.
Okay guys, so this is the second episode of our finasteride series. And if you're interested in finasteride, how it works and why you should take it, please don't forget to watch our first video, which are the things you need to know before you take finasteride. But today we're getting into the side effects of finasteride, why would somebody experience it, and what you can do if you're experiencing these side effects, because we don't want you to give up on finasteride because it's such an important medication in our arsenal to treat balding.
So one of the most common questions we get asked is about the side effects of finasteride. And the most distressing, of course, to most men is the loss of libido and the erectile dysfunction.
So about 2 to 8% of men who take finasteride at a dose of 1 milligram per day do experience some of these sexual side effects. Now let's not forget that these side effects are on a continuum and they're very subjective because it's difficult to objectively measure somebody's erectile functioning or somebody's libido. Also, to add to these side effects, we can't forget the notorious nocebo effect. And that is the exact opposite of the placebo effect. What does that mean? It means that if you're expecting something so horrible to happen to you, you manifest these side effects in your own mind and therefore you have the subjective experience of them.
And guys, let's also consider that those 2% of people who do experience erectile dysfunction and loss of libido might just be reporting a change in normal functioning, or as they like to say, a little bit of lead out the old pencil.
Now, I know this sounds like doom and gloom, but guys, please don't worry, because in all of the clinical trials they are conducted, all side effects completely stopped within the first few weeks of cessation of medication. And in our experience, and the experience of all our colleagues actually, we have never seen long-lasting side effects after stopping finasteride.
So now we know that the internet is full of fear-mongering and websites dedicated to post-finasteride syndrome.
And the post-finasteride syndrome is pretty much that after you stop taking finasteride, the side effects you're experiencing never end. Ever.
So obviously we take this extremely seriously, and as Asi said earlier, in our experience and the experience of our colleagues, we've never actually seen a case like this. To be honest, in my opinion, probably the opinion of Asi, we think that these are related to other issues such as diabetes, low testosterone, psychological disorders, and other endocrine issues.
So what if you're the unlucky 2 to 8% of people who are experiencing some sort of side effects on finasteride? Well, don't worry. We want you to continue taking this medication because it is so vital in the hair loss treatment regimen. So we're going to give you a number of tips and tricks that we use in our practice to mitigate side effects of our patients. So the first thing we want to look at and make sure is that these side effects are not happening within the first 2 to 3 weeks of starting treatment. Because if they are, we normally say stick to the treatment and let's see if you can't power through that initial phase, because usually they do go away after that period of time.
So after about a month, if you're still experiencing some side effects, what we would normally recommend is that you taper your dose down to about 1 milligram 3 times a week. That normally works quite well for people and they can carry on with that
indefinitely.
Exactly.
Well, what if you're still experiencing side effects on 3 milligrams per week? Well, there's a lot of evidence that 0.25 milligrams per day works really well, and this is out of studies coming from Korea, the good Korea.
Of course. That's basically a quarter of a 1 milligram tablet every day, which is only 1.75 milligrams a week.
And it's proven to actually slow the hair loss down quite significantly.
So let's say you're still having side effects. You're taking 0.25 milligrams a day and you're still experiencing side effects. What do?
I would suggest take 0.25 milligrams every other day. Okay, so that's 1 day yes, 1 day not. So you've substantially reduced that dosage down. And, in our experience, we still find that that tiny dosage still helps with the hair loss process.
And for those of you who cannot tolerate oral finasteride at all, don't worry, there's still hope for you.
There's a lot of studies that have recently been done on topical finasteride, and they're showing some amazing results. For our patients who don't really tolerate oral, we like to give them topical finasteride. The most commonly studied dose is 0.25%, and that has shown to have significantly less systemic absorption, so less plasma levels and higher levels within the scalp. So it's still doing its job in the scalp, and it doesn't give you as bad side effects. However, it is still systemically absorbed, and if you are very sensitive to finasteride, you may still experience side effects, unfortunately. So Eric, if all these low dose regimens work so well, why don't we just start people on a low dose? Surely that's better.
Well, that's because 1 milligram finasteride is generally tolerated very well. It's also been shown to be extremely effective over long-term studies. The lower doses have unfortunately not been studied as extensively, and for that reason, we like to start with the 1 milligram and then taper down slowly.
So please guys, if you have been having side effects with finasteride, it's not over for you. There are multiple different dosing regimens that you can tailor just for yourself. I've been doing it myself for a number of years, and actually in my next video, I'm going to post my own hair loss routine that I do every single day.
That's a good idea. That's all for today, guys. Thank you so much for watching. If you like this video, please like, share, and subscribe. Goodbye for now.
Bye.